Well, there are over 1,200 people in Ontario hospitals with COVID-19, according to the health minister. But what we don't know is how many of those people were admitted to the hospital because of COVID and how many tested positive with the virus after they ended up in the hospital with other issues. So the total numbers are inflated, according to Dr. Martha Fulford, an infectious disease specialist at McMaster.
So when we admit people to hospital right now, everybody gets checked for COVID. So we do an automatic COVID swab. So if, for example, somebody comes in with abdominal pain and we diagnose them with appendicitis, they also get swabbed for COVID. And up until now, all of these patients were basically labeled as COVID admissions. And that is an important thing because it makes the situation feel worse than it is. And when you have a lot of community transmission, as we do right now, there are a lot of people with COVID. The question is how many people with COVID are actually sick because of COVID and how many have a mild cold or have no symptoms. So it's an incidental diagnosis.
And I did reach out to the Ministry of Health today, and I'm told that the way the numbers are being reported by the hospitals will be changing. So those numbers will be broken down to show who is sick with COVID and others who just happen to have COVID and are in the hospital. No time limit yet on when we can expect that to happen, but it will give people in Ontario a clearer indication of who's actually sick with the virus in the hospital.